Welcome to Medscape. I'm Dr. Andrew Wilner, reporting for the virtual American Epilepsy Society meeting. With me today is Dr. Charles Szabo, Professor and Chief of Epilepsy at UT Health San Antonio. Dr. Szabo presented a very interesting case about a patient on cannabidiol adjunctive therapy. Welcome, Dr. Szabo.
Thank you very much for inviting me.
Dr. Szabo will tell us about your case report.
Yeah, so it's about a patient who actually has a history of epilepsy since he was 7 years old. And when we reported on him, he was 63 years old. And he, for a long time, had been very well controlled. His seizures had been very well controlled. He had mainly tonic seizures and myoclonic seizures, often in his sleep or just upon awakening, at times during the day too. And we suddenly, when he was 57, 58, and without any clear reason or cause, his seizures started to recur more frequently. He started having more serious seizures, like convulsive seizures. And what happened was that we had to actually start trying different medications. And we went through a number of different medications and ended up with a very unusual regimen, even for epileptologists, unusual regimen of him being on a medication called tiagabine, perampanel. He was also on levetiracetam and clonazepam. And with that regimen, actually, he did quite well. And he was having maybe two to three seizures a month. And he was happy, but he really wanted to go back to driving. He had a son. He also was a real estate agent at one point. He was really wanting to become a little bit more independent and not be mainly at the house. So he was very interested in trying the cannabidiol. And at first we weren't able to enroll him in the Epidiolex, or try to prescribe him Epidiolex because there are certain limitations of indications from the insurance companies. So we actually started him on a medication, a cannabidiol preparation, which was allowed by the Texas Compassionate Use Act. It's basically based on a registry in Texas that you can actually prescribe this for people with, at that time, only with medically refractory epilepsy. And we actually, got him on this regimen initially, and he was actually pleased because his seizures went down to maybe one seizure a month, but he was a little bit tired and lethargic. So we started sort of looking into some of the interactions. We decided to lower one of his medicines, perampanel, and that helped that. But it was very weird or unusual that he developed at one point this, and it was during a dinner party, that he became sort of confused. He was kind of twitching, having myoclonic twitches for about 20 to 30 minutes. And which was sort of the wife had never seen something like this, and we were wondering, what really was going on, but we didn't have an explanation. But because he had such a good response to the CBD, we decided to go on. He was able to actually qualify for the Epidiolex, so we started him on the Epidiolex. And with the Epidiolex, we titrated him, over a course of 1 to 2 months. To a dose of 20 mg per kilo. And, initially he felt there was an improvement of his seizures, but then every week, every 2 weeks, he started having these unusual episodes similar to that dinner invitation, but they were always during the daytime, and usually late in the morning. And these episodes lasted not only 30 minutes, sometimes a few hours. And where he was very confused, he was sometimes responsive, sometimes he wasn't. He occasionally also sort of exhibited some unusual motor behaviors. But he was really, of course, amnesic for the entire episode, and usually was very tired afterwards with sleep. And, when we started hearing this, we weren't sure were these, what type of was this a side effect, perhaps, what exactly was happening. But of course, these, he wasn't hurting himself or injuring himself. He was in a safe situation, but this sort of came to, we at one point were discussing with his wife, well, if he's going to have any more of these episodes, please bring him into the hospital. We have to find out what these were. So when we admitted him, that's when we found that he had actually, by EEG, non-convulsive status epilepticus. So at that point, of course, we treated that, but we also withdrew the Epidiolex. And he, since then, has never had one of these episodes before. The big question in this abstract was, was this really due to the Epidiolex, or was it potentially due to interactions with other medications? And that's the.
And what's the answer?
Well, we don't have the answer. And I think, a lot of we don't really have the answer because this really hasn't been reported. At least we haven't seen any reports of de novo non-convulsive status epilepticus in a patient put on cannabidiol. So when they did the studies, and they were looking at mainly the patients in those studies were mainly Lennox-Gastaut patients, or people with Lennox-Gastaut syndrome, and also with Dravet syndrome. And there were a number of patients who had to be withdrawn from the study because they developed status epilepticus. But of course, these are very severe neurological diseases where people tend to have status epilepticus. So there wasn't necessarily a de novo episode. And so cannabidiol has been seen to aggravate potentially seizures in some cases. However, this case was a patient who has a focal epilepsy, does not have any known genetic disorder, and he responded with a totally new type of seizure. And this was actually, I think, what was interesting about it. I think, the larger point, and I'm sure you'll be addressing this also in your questions, is that, many of the patients who come to us there are a number of people who actually seek us out to start cannabidiol because they feel like this is such a natural product, it must be good for you. And what I think this abstract also sort of points out that one has to be aware not only of the cannabidiol side effects, but also the interactions, which there are quite a few with other medications.
Well, your paper attracted my attention because I participated years ago in the development of tiagabine. And I had a patient who developed non-convulsive status epilepticus, and I was totally perplexed. This guy, I still remember I had him in the examining room. He's kind of spacey. And, we see that a lot usually from drug toxicity. And it was a brand new drug at that time. And I figured, well, you're taking too much, but, I don't know. So we brought him in the hospital. We have epilepsy monitoring unit. And sure enough, non-convulsive status epilepticus, that was a new thing. Of course, now it's well known that tiagabine can do that. And I noticed that your patient was also on tiagabine. So maybe that's what kind of pointed you in that direction. You say, oh, well, maybe we better check this guy out. So before we wrap up, clarify, when should we be using cannabidiol? Where is it FDA approved, and what are the indications?
So the specific sort of FDA approved product, which is Epidiolex, has an indication in Lennox-Gastaut syndrome, and also for Dravet syndrome for patients 2 years and older. So I think those are the indications. It's basically used as an adjunctive therapy. But there's a little bit, there's an interesting sort of indication. The way the indication is phrased, it is phrased as for seizures related to these syndromes. And these seizures could also include focal seizures. So, of course, insurance companies read this maybe a little bit more narrowly. So that's been a little bit of a challenge to get people on this medication. But it is used as an adjunctive therapy. And of course, it really actually was very efficacious in the studies as an adjunctive therapy for people with Lennox-Gastaut syndrome and Dravet syndrome. I think producing like seizure reduction of 40% in both of those cases. But there are side effects. And I think one of the biggest issues is that there are a number of interactions, medication interactions. And one of them, because actually this CBD actually blocks or inhibits a number of the CYP450 enzymes. And some of those isoenzymes are important, for example, in metabolizing thiagabine or perampanel or topiramate or other type of medications. So it's very important to know those type of interactions when you're starting this medication. Just because it's natural, it doesn't mean that it's only safe. And there are a number of also other side effects to pay attention to, such as hepatotoxicity, especially when you're combining it with medications like valproic acid or clobazam. So these are all things that one has to sort of pay attention to when you start a patient on this medicine.
Well, Dr. Szabo, I'm sure you're going to be continuing to follow this patient, so maybe we'll have an update. He may tell you that he wants to try it again. We'll see what happens.
Yeah.
And I'd like to thank you very much for sharing this paper with Medscape.
Okay, thank you very much.